Go to that point about how much we miss the point about the role of men, of Filipino men in population management.
Okay. First of all, I'm very happy that Undersecretary GP is there. 50 years old na yung Commission on Population and Development. But that's the good news. The sad news is our contraceptive prevalence rate and maternal mortality rates, both indices of the health of population, is not growing as fast as we want and still very low compared to our Asian neighbors. So the point of your question, what a new thing should we be doing? What business unusual should we be working on? And the hypothesis and the suggestion that we are posing is, throughout those 5 decades, throughout the last 25 years since we made the promise in the International Conference on Population Development, the role of men has not gone beyond 2% when you look at contraceptive prevalence rate. So translating this in layman's terms, for every 100 women using family planning and contraception, there are only 2 men, most of whom would be using condoms, and almost none will be having vasectomy.
Okay,
So
let's go straight into that. Now, because when people talk about, yung lalaki kailangan may papel din sa contraception, yun nga, condoms lang ang pinag-uusapan natin. But what else is there? I mean, what other things, interventions, services, products, practices can males do?
Okay. First off, even before the acceptance of family planning products, the role of men in facilitating the choice of the woman is important. What we're seeing from the surveys is men and the mother-in-laws are often the constraints to women accessing the services. But with that said, it's still important to encourage male methods of family planning. Condoms are very important because apart from the contraceptive use, they are also essential for preventing sexually transmitted infections. But the point of your question again, those methods, condom, is good for men and couples who want to space their pregnancies. What we're seeing now is when you ask couples, they are already happy with the number of children they have. So for these couples, a more permanent method of family planning is important, and this is what is being missed. No scalpel vasectomy for men, in addition to what women already use now, bilateral tubal ligation, that is again a surgical procedure for women. The no scalpel vasectomy is a much simpler, cheaper, and even a safer alternative that encourages male involvement and men assuming the responsibility for contraception.
How much cheaper? How much simpler? Kasi vasectomy, dami ring natatakot dyan pagka sinabing vasectomy, di ba?
Yes, correct.
But tell us how simple is vasectomy right now? I mean, relative to vasectomy as people may think of it before, and certainly relative to ligation.
Yes. That's a very important question, Robbie. To answer that, in terms of anesthesia, we have what you call no needle anesthesia or even the minor needle anesthesia.
Topical lang.
Spray lang. Spray lang pwede na. Mainly because vasectomy is done on the scrotum, while ligation is done in the abdomen. So the abdominal surgery, although it's very small for the woman, it's still more invasive. Yung procedure sa lalaki, it's much simpler than even the circumcision that we are more familiar with.
Mas simple pa ang vasectomy kaysa sa tuli.
Yes.
Less bloody.
Kasi yung tuli, as GP Director, USEC GP was saying, it's more bloody. There's a cut of the skin that's involved in no-scalpel vasectomy. After the anesthesia, there's only a puncture and a stretching to reach the tubes of the men. And when the procedure is done, you just pull out the instrument, the scrotal skin automatically closes. So you just need a Band-Aid, no need for suturing. Yeah.
Oh, you mean that literally Band-Aid lang yan, wala nang tahi-tahi, pagkatapos localized lang yung anesthesia. It makes it, you make it sound as if, and tell me if this is actually true,
Yes.
you can get it and then you walk out of there?
That's correct. Precisely, Robbie. We have clients from the Visayas who are cargadores. They carry their sacadas who carry sugarcane or cavans of rice. They fall in line, wash the scrotal area, have the procedure, walk out, and continue working.
Ah, okay. It's even easier than having nang bunutan ka ng ngipin. Di ba? Pag bunutan ka ng ngipin, sasabihin ka pa na, oh, wag ka magbuhat, wag ka magtrabaho.
Yes.
Ito pwede pa.
Pwede.
Okay.
Ang hindi lang pwede gawin, makipag-mixed martial arts ka kasi baka masipa yung pero other than that, pwedeng magtrabaho.
Mayroon pang mahalaga.
Yes.
For 1 month, di ba?
Tigil muna.
Yun lang. Kasi pagka talian natin at saka putulin yung tubo, merong natitirang sperm cell. So you need 12 weeks to purge the sperm cells before totally free and safe na yung lalaki.
Okay. Magkano yan?
Okay. PhilHealth pays for the procedure. So if you're a PhilHealth member, it's essentially free.
And you can get this anywhere?
That's the second rate limiting step. We only have 30 no-scalpel vasectomy surgeons in the whole country. Most of them are working with PopCom, but even then, kulang na kulang sila. So you need advance notice of where the service is available in order to get matched.
But even with 30 certified, and I want to bring in Dr. GP here, even with 30 certified doctors, if this is as simple as it sounds, and again with that comparison sa tuli, no? May mga libreng tuli, di ba? You go into a barangay, libreng tuli, oh, lahat ng ano diyan, tulian lahat. Is it that simple that you can go into a town, a barangay, and say, oh, sinong gustong magpa-vasectomy dito? We can do this for as many men as willing to come this Saturday.
Yes, actually, some local governments do it that way. But may konting social preparation.
Yes.
You have to get them on a list, let's say, the week before. Make sure that they're very clear that they don't want any more children. And then, usually, some local chief executives even that are very supportive will give some support. Bigyan ka isang sakong bigas. No? Parang compensation for the work that you're not able to do on that day. But I'd like to also put it in another way. There are 2 million women who don't want to have any more children. They want to limit the number of... so it's an opportunity for men to step up. Yung 2 million na yun, they don't have to get a tubal ligation. Why not get the partner, the male partner, to get the vasectomy?
Which brings me to one final question. Na-intriga lang ako, John D. No? You mentioned kanina na ang dalawang pinakamalaking balakid sometimes sa mga kababaihan for a household to manage a population is the male and the mother-in-law, you said.
Yes.
So the mother-in-law, you're referring to yung nanay nung lalaki o yung nanay nung babae?
Nanay nung lalaki.
Nanay nung explain the dynamics there. What is the thinking and what is the factor there?
Okay. This is only based on the National Demographic and Health Survey. We surmise that number one, mother-in-laws want to have more apo. Doon naman sa male side, the machismo tends to encourage them to have more children. So it's the woman who bears the brunt of delivery and who's placed in danger. So we're trying to get more men who will be sensitive to the fertility objectives of their partner And I'd like to think that we're slowly getting there. When we started this program, we only had 20 vasectomies in a year in the whole country. Then it went up to 200. Now we're averaging 2,000 per year. But as Undersecretary GP said, the target is to reach 2 million women.